Can you get away with not doing surgery for an unstable locking meniscus tear? Hey, this is Dr. P. Got a problem with your knee? Ask Dr. P. And that's the exact question I got. This person had an unstable meniscus tear that was causing locking, and they wanted to know if they can quote unquote get away with not having surgery because they had a friend who had locking and the locking went away. Well, the locking isn't always a meniscus tear. It could be something loose floating around in the knee, like a loose body, and that can sometimes go towards the back of the knee, scar down, and not lock the knee up anymore. That's one possibility of why a knee might stop locking up. But another possibility is, in a knee here, you have your thigh bone, your femur, your shin bone, your tibia, you have your kneecap right here, and in between the bones, there's cartilage on the end of the bones. Looks like the white on the end of a chicken bone. That's like the tread on a tire. When that wears down, that's what arthritis is. But you also have the meniscus cartilages in between the bones. And so if you have what we call a bucket handle meniscus tear, sometimes it'll flip underneath the meniscus. I can't really get that to do that on the model, but it'll flip underneath here. Or you might have a flap flipping back and forth, and then it flips underneath the meniscus and it locks in place there and it scars down. And so the locking will go away and the symptoms will feel better for a while. The problem with that is there's still a tear there, the meniscus is underneath, and now that causes an abnormal meniscus, abnormal forces on the cartilage on the end of the bone, which will start to wear down, and then sometimes that'll even cause abnormal forces on the bone underneath, and you'll get stress or microfracturing or soft spots, and that's why people will still get arthritis if that happens. So yes, you can kind of get away with a unstable meniscus tear that was locking up that stopped locking up. I have heard of that, but I would recommend still getting in to see an orthopedic surgeon. You might need a repeat MRI. You might need to even go in there to make sure arthroscopically that it's not just flipped up underneath and still going to cause problems later on down the road.